Right, let's get back to the subject we're focusing on this morning, the state of the NHS and how we can keep it healthy and fit for the future. That task has fallen to Neil Gray, our new Health Secretary. He's only 3 days into the new job and presumably already swamped with information and briefings, but he did take a few minutes out just before we came on air to talk to me about his plans and his priorities. Neil Gray, congratulations on the new job. It is a big brief and a big responsibility. How would you assess the state of Scotland's NHS just now?
It's an NHS that's recovering from the COVID pandemic and also from the impact that Brexit and inflation and wider pressures have had. And it's not just a pressure that's been faced here in Scotland. It's not a unique pressure just to Scotland. It's been felt across the UK. And you said there around responsibility. I certainly feel that responsibility because this is a service that is cherished by people across the country and also that touches all of our lives from beginning to end. So I certainly feel the responsibility to do my absolute best, which I will do alongside a very good health team with Marie Todd and Jenny Minto, and an incredible level of commitment from our staff across the country that I am incredibly grateful for.
Where you said it's recovering, a lot of people would tell you from their experience it is struggling. A lot of staff who work in it would tell you it's struggling. There are problems right across the board there. What is your priority? What do you do first?
So I'm looking to make sure, first of all, that our staff continue to feel valued. They are, of course, the best paid staff anywhere in the UK, and that is down to some incredible work from the likes of Michael Matheson, negotiating in good faith with our trade union representatives, making sure that we haven't lost a single day of strike action compared to anywhere else in the UK. We've got junior doctor strikes in England and in Wales, further potential strikes from senior clinicians. That's not something I take for granted. I want to continue to drive down on waiting times, both for outpatient appointments and for inpatient, and for us to see a continued improvement on accident and emergency waiting times.
Let me pick you up on a couple of things there. You're talking about specifics there, accident and emergency times, for example. Well, can you pick one area that we can judge you on in the next, say, 6 months? One area that you are going to have made a specific difference. Maybe it's cancer waiting lists, maybe it's operations, maybe it's A&E, whatever. Where should we judge you?
Well, I'm in, I think, the third day of the job, Martin. So I want to take a full assessment of where things are before I set out further where I think improvements can be made. But of course, we already have very direct commitments made through the First Minister's mandate letter with Michael Matheson, which is about improving the recovery. You've spoken there around accident and emergency. I've also spoken about and you've spoken about cancer waiting times. On all of these areas, we want to see continued improvements.
Right.
On the 31-day cancer waiting time, the most recent figure, we missed that by 8 patients, that target. We want to, of course, go further and make sure that we're meeting that 95% target. We're seeing more people.
Missing by 8 patients isn't good. Forgive me for thinking you're almost presenting that as a success. You set yourself targets that are achievable and you miss them all, it seems.
But we're seeing more people in time than what we have done pre-pandemic. I absolutely grant you, for those people that haven't been seen within 31 or 62 days, the target, that is not acceptable, and I need to make sure that we continue to improve that.
We saw in a report last week there's more money going in to our hospitals, and there are more doctors and nurses now working in our hospitals than there were before the pandemic. Both have increased since 2019, and yet our hospitals are doing less. Productivity is down. How is that?
So obviously there are pressures across our NHS, and the IFS report recognised that for across the UK. It did recognise that we are seeing record health spending here in Scotland, £19.5 billion through this budget, and a record level going to our NHS boards to deliver that.
But does that not just prove that throwing money at the situation doesn't help?
As I've said, we need to see reform. We need to see improvements, and that includes through improvements in productivity. And that is what I'm going to be looking at in the coming weeks around what more we can do to improve the productivity across our NHS. But we have to recognise that we are seeing more people through our NHS. we're seeing greater demands upon all levels of both our NHS and social care sector. We're going to need to reform the way that we work, but I want to make sure that that reform means that we're having an increased capacity, and that's what's going to be critically important.
Are we seeing more people? Because productivity is down. My reading of that is that we're treating fewer patients.
Well, for instance, on cancer, we're seeing on the 62-day pathway, we're seeing 50% more people than what we did 10 years ago. So the demands upon our health service are increased and increasing. That's not unique to Scotland. It's across health services around the world. But we've got a particular challenge in terms of our demographics in Scotland. And I must make sure in helping to lead the NHS through the recovery from the pandemic that we improve productivity. We continue to see the support for record staffing levels that we have across our NHS, so that we can make sure that we continue to have a service that is cherished by people across Scotland and meets their needs whenever they do need it.
Have you got the money to do what you want to do with those staffing levels? I'm looking at the front page of Scotland on Sunday here. Doctors' pay row looms as unions warn new minister. That is you, clearly, Mr Gray. Scottish Government Health Chief Gray must act quickly over wages, recruitment and funding, say BMA. Do you have the financial capacity to do that?
I've set out earlier that we already have the highest paid staff anywhere in the UK and the NHS in Scotland. That's important because we have had a constructive relationship with our staff and with the unions who represent them. So I'll be looking forward to sitting down with BMA representatives as soon as possible for those discussions. I have a family member who is a junior doctor and who is in touch with junior doctor colleagues elsewhere in the UK. I'm not saying things are perfect in Scotland, but the challenge being faced elsewhere in the UK, where we're seeing ongoing strikes in Wales, ongoing strikes in England.
But UK comparisons, Mr Gray, are all very well from a political perspective. But if you're a care worker, and I know they've been given a pay rise that comes in April, but still it's not very much money per hour that they're earning. If you're a care worker and you've got to do 3 jobs just to feed your kids, being better paid than a Welsh care worker is scant consolation. And that doesn't address the massive explosion in the care sector that we're going to see in the next 20, 30 years and the massive demand we're going to have, does it?
But it's important context to understand what is going on elsewhere in the UK, Martin, because we're facing very similar challenges. We all went through the same COVID pandemic, feeling a similar impact from Brexit on workforce. So it's important to understand, because I think...
Sure. The point I'm making is if you don't have the money to pay properly, you're not going to get the staff, and we need the staff. And if you don't have the staff, the system's going to fail. Do you have the money is the question.
No, what I'm saying is that it's important to understand the context elsewhere in the UK, because I think my opponents would suggest that the challenges that we're facing in health and social care are somehow unique to Scotland. They are not. In terms of funding, we're putting record funding, a real terms increase into the health and social care budget. £19.5 billion includes funding for uprating the pay of social care staff to £12 an hour. If we had followed spending plans from Westminster, we would have seen £500 million cut from our NHS and social care sector, because that is what is being delivered for the NHS in England. That is why it's important that we recognise the context upon which the decisions we are taking here in Scotland really matter.
You mentioned reform earlier on. Michael Matheson, your predecessor, said in his resignation letter that the NHS was, quote, in need of major reform to remain sustainable. And he thanked the First Minister for his help in developing plans to take these reforms forward. What plans, what reforms are we going to see? What are they going to look like?
So I'm expecting to take a paper to Cabinet in the coming weeks and months in order to set that out. I'm looking to see what the detail of that is going to be, and I've got introductory meetings across our health service next week in order to hear more about some of what Michael was working on.
How radical are you prepared to be?
So I'm willing to be pragmatic. I'm willing to consider the evidence and the advice that is given to me, not just by my officials within government, but also staff and trade unions around what is possible and what is most likely to work. And I will take decisions on that basis.
Could we see an NHS where people have to pay for some stuff if they've got the means to do so, ever? Or is that a red line?
So that is where obviously the Conservatives are looking, and where Labour's Wes Streeting has said he will open the door, open the front door to the NHS in England if Labour are elected to the private sector. I want to make sure that Scotland continues to have an NHS that is public, that is free at the point of need, and make sure that that continues to be the case going forward. That's going to be a challenging proposition, I grant you, given the pressures that we're facing, given the cumulative impact that 13 and a half years of austerity has helped to deliver. But we remain committed, as is evidenced by the record funding levels that we've seen, the real terms increase for NHS boards in this budget, the real terms increase, the meeting of the commitment for the 25% increase for social care to £2 billion, met 2 years early. We are committed to delivering a health and social care system that works for the people of Scotland.
OK, would you accept that you don't have that at the moment? Would you accept that what we have in Scotland just now is a two-tier health service? Every time we do a phone-in on Radio Scotland about the NHS, you get people saying, I've spent my life savings on getting a new hip because I couldn't bear the pain. I've waited 2 years. Now my kids aren't going to get an inheritance. I've got nothing left in the bank, but my life wasn't worth living anymore. I've got people I know who have gone through that. I'm sure you do too. People who just aren't getting seen and getting treated on the NHS are going private. So it is a two-tier health system at the moment, is it not?
So it's unacceptable that people would be in that situation.
Do you accept they are?
But I do accept that some people have been in that situation, of course.
Lots of people,
and that's why it's important that the work that I'm seeking to do is about increasing capacity, increasing productivity of our hospitals, and that's why we've taken through 2 new national treatment centres already. We've got.
Would you accept my premise that we have a two-tier health system effectively at the moment in Albany?
No, I'm incredibly
So how
proud
do you
of our
explain the
national...
fact that people are so desperate they have to go private and they're spending money in some cases that they don't have? If that's not a two-tier health system, what is it?
No, we've had capacity issues in our National Health Service. I think that's well documented, Martin, but we're looking to tackle that. That's why we've brought on stream 2 new national treatment centres already. 2 new national treatment centres are still to come, which is about delivering increased capacity to work through those long waits. And those long waits are coming down. We know that. But that, I know, is very little comfort for those people that are waiting too long for operations that they need, that have been impacted by the pandemic. And I am going to be looking at what more we can do to try to make sure we're increasing the capacity and the productivity of our health service to ensure we're meeting the needs of the people of Scotland. That's got to be the overriding mission.
Let me move on from health. Elsewhere in the papers this morning, I'm looking at the front page of the Sunday Herald. Resentment, rows and resignations. SNP insiders lift the lid on a factionalised party. And why the First Minister must escape Sturgeon's shadow. I know you're not going to tell me it's a factionalised party, a party at war, whatever, but is this the same united, strong party that it used to be?
So I haven't seen that report that you're quoting. So
you just heard the headline.
I've heard the headline, but I haven't seen the sources that would be seeking to back that up.
What's your evidence, though? Is it united?
But in my view, yes, I think we've got a very strong group in government. We've got a very strong group at Holyrood and a Westminster group led by Stephen Flynn that is taking it not just to the Tory UK government that is in an absolute shambles, but also shining a light on what a next Labour government would look like. So I think we're in a very good place. And if you look at
here's the thing, though. Here's the thing. There was a very tight leadership race, right? And Hamza Yousaf just won it very narrowly over Kate Forbes. Yet every single member of his cabinet backed him. Is that really bringing the sides of the party back together?
And we've just seen Jim Fairley being appointed
in a very junior ministerial role.
No, I think his
not around the cabinet
incredibly
table.
Important. His role is incredibly important.
But it's not a cabinet role.
And I'm good friends with Jim, who is going to bring an incredible amount of experience to ministerial office from an agriculture and connectivity.
But he's not in the cabinet.
I'm very pleased to see that. And I think there is an opportunity for the likes of Jim and others to get on. That is what Hamza, the First Minister, has made clear. I think we've got an incredibly strong team, and the backing that the First Minister has is incredibly strong. That is an evidence from the appointments that he has made this week.
Last question before you go. Should Michael Matheson be taking his £12,000 severance payment given the circumstances of his departure?
That is an obligation. That is a right that is afforded to him in demitting office.
Yeah,
it's
but
for
should
him
he
to
be
decide.
taking it?
It's for him. It's for him to decide in the circumstances.
Would you have taken it?
I think Michael has given 25 years of incredible public service as a member of the Scottish Parliament, and over a decade of experience as a minister in the Scottish government.
Would you have taken it?
He has dedicated himself to public service. He made a mistake. There is no doubt in that. He has admitted that and apologised for that mistake. And I think he's afforded the due process that has been going through.
Indeed,
by the Scottish Parliament.
None of that is in doubt necessarily. Would you have taken the payment if you were leaving in similar circumstances?
So that's a hypothetical question I'm not willing to entertain. I think it's for Michael to decide now upon whether he takes that.
Okay, right. We're not going to get any further with that. Neil Gray, I'm sure we'll speak again before very long. It is a big and important brief you have. We're going to be discussing it regularly. Thank you very much, though, for being with us on the Sunday show this morning. Good to hear from you.
Take care.